I now recognize Ms. Lesko, Vice Chair of this subcommittee, for her 5 minutes of questioning.
Well, thank you, Mr. Chairman, and thank you for all of you being here today. I don't know if you've ever read the riveting deposition by Dr. Fauci in a lawsuit, but this is where this question is coming from. In a deposition in November 2022, Dr. Anthony Fauci was questioned about an email exchange he shared with former HHS Secretary Sylvia Burwell in February 2020. She asked him in the email, "I am traveling to," it's a redacted location, "folks are suggesting I take a mask through the airport. Is that something I should do?" And Dr. Fauci responded to Ms. Burwell saying that masks don't protect uninfected people from acquiring infection. He recommended not wearing a mask. And I remember being in Homeland Security Committee at the beginning of this whole thing, and the healthcare workers were wearing masks, and then the government official said, no, you shouldn't wear masks, like the standard people shouldn't wear masks. And it seemed like it went back and forth. It was very confusing to the American public. So my question is, why do you think, I guess this is to Ms. Dean and Ms. Hogue, why do you think Dr. Fauci would tell a personal friend not to wear a mask, and then later, I mean, it was shortly later, after that, he said, everybody should be mandated to wear a mask?
I can't speak to what Dr. Fauci was thinking or really comment on his statement. I will say that in the U.S., because there are about 3,000 local nodes of local health officers who have the authority to give recommendations, issue mandates, and then 50 state health officers, that what we really have is a patchwork quilt. So it's never a surprise in the United States when different places are giving different recommendations. That's part of the problem that I think we need to fix with a coordinated intelligence capability, operational capability. It led to a lot of confusion during COVID, including different and conflicting mask mandates in different parts of the U.S. with different officials speaking to them.
Yeah.
And I guess I would add to that the evidence that we had going into the COVID-19 pandemic for influenza-like illness had failed to find in randomized studies that masks prevented transmission in the community setting or the hospital setting. And so in the summer of 2020, and I think you said 2022, but I think you meant 2020.
Oh,
that was
okay, sorry.
Fauci.
Thanks for correcting.
We didn't have good evidence showing that masks worked. And so, it was really up to us to generate good data to find out, were masks going to be effective against COVID-19, surgical N95 masks. The United States did not run randomized studies in our country to get the answer to that. And so really, we then had a Cochrane review that reviewed the data, the randomized studies that have been done during the COVID-19 pandemic. They didn't find that masks were effective at preventing COVID-19 transmission. They failed to find that in the randomized studies. However, the United States continued to recommend masking of children down to age 2, which they actually still do today under certain circumstances. So we act like we're talking about things in the past. CDC is still recommending children down to the ages of 2 mask under certain circumstances of high disease burden. And so I think that he said that because that's what he felt the data showed at the time, and that, in my understanding of the data, was an accurate representation of what we knew, that masks were not effective from the data that we had.
Yeah, I think, part of the reason that we're asking about this is, in fact, most of the reason is we don't want to repeat the problems that we had before. And, I'm also on the select subcommittee investigating COVID and its effects. And one of the things I think we talked about there was the closing of schools for our children and how far behind they are. And Ms. Hogue, I don't know if I had a chance to ask you questions last time, but in Sweden, if I remember right, they didn't close the schools at all. They didn't close the schools at all.
They didn't close
and none of the kids died, right? None of the kids died. Is that accurate? From COVID.
So from their initial report, there were no children that died. I don't have the latest data
Right.
I apologize, but yeah, but they did not close the primary schools, and then they've had very brief closures of the secondary schools, and their excess mortality, I mean, their excess mortality has been none to
Yeah.
negative. I mean, they've done probably one of the best countries in the world during the pandemic, if not the best.
So, Ms. McCauley, do you think that the CDC in the future could look to what other countries did? If this happens again, which eventually it will happen again, do you think that they should look to what other countries did? Because some other countries didn't do all these mandates and closing schools and things like that, and they didn't seem to have a problem. Do you think that's a good thing for the CDC to do? Sorry, I
Yes.
ran out of time.
We've always encouraged to look at all lessons learned and to revise plans as needed,
Thank you.
domestic or international.
Thank you.